Hello and welcome to ESC Studio 2012. This afternoon we're talking to Dr. Ashraf Anwar about EUROECHO and other imaging modalities 2012. If we could begin by just discussing your sort of way you work, your clinical practice and your areas of interest, that would be great.
Thanks for this introduction, and also thanks for the chance to be with you, to be introduced as a fellow of European Society of Cardiography and attendance at that Congress. I already professor of cardiology in Al-Azhar University in Egypt, and in time now I'm working as a consultant cardiology in King Fahd Armed Forces Hospital in Jeddah, Saudi Arabia. My field of interest is echocardiography in general, especially for the 3D echocardiography. And I started also to pay my attention toward the speckle tracking, which is a new era now for detection of myocardial deformation, which is important in very or multiple areas for myocardial function, for valvular heart disease, for ischemic heart disease, and so on. So I started to collect some data regarding speckle tracking and to compare with what we are using in routine daily work is assessment of myocardial function by visual estimation, scoring or motion score index by visual estimation. And I found that if we are using speckle tracking for this era, we will avoid many of limitation of visual motion score. There is no high training learning curve needed for this speckle tracking. Second thing, also the higher inter-observer variability is also less for speckle tracking.
That's very interesting. So what in particular made you want to submit an abstract about this research to EUROECHO and other imaging modalities 2012?
I already, several times I attended this congress, and I found it's a good way to publish your work and to show everybody your result of work and your research topics. So it's better to be shown by everybody.
And how important is it for you for your personal professional development to submit an abstract to a meeting like EUROECHO?
It's good for everybody. Even if you attend without any abstract, without any sharing, it's important to collect a lot of information from many experts in different fields, especially for echocardiography, not only echocardiography, but also this year will be added for other modalities for myocardial imaging, like CT, MRI, and so on.
And talking of other imaging modalities, obviously you're submitting your own abstract, but what outside of that in the sort of EUROECHO field of areas that they're covering at this year's meeting is of interest to you, obviously aside from your own?
Yeah, I think this year also will be more valuable information because you collect a lot of echo modalities, and beside also other imaging modalities, CT and MRI. It was a very fantastic idea to make it other echo modalities, other imaging modalities besides the echo, not only for echo.
And as an attendee and as somebody submitting an abstract, what are your expectations from a meeting like EUROECHO?
Time now this year, I expect more attendees, and also I expect more interesting for this field because time now you are collecting radiologists, you're collecting cardiologists, you are collecting even physician. All these people will come to attend other modalities in addition to echo.
Which I suppose underlines the importance of actually physically attending a meeting like EUROECHO. And one final question, do you feel that abstracts contributed to EUROECHO are given sufficient visibility within the meeting?
Yeah, it has a good visibility, but sometimes time is very short to be explain your work during a congress. Sometimes it's just a booster to be for a short while. Earlier presentation or late presentation cannot be attended by everybody, but at least time now we have the availability for to be seen either by website, by CD available, or by even the abstract book available for everybody.
Well, that's great. Thank you very much for your time today. Really appreciate it.